So I'm going to go through the actual process of what's going to happen during the clinical trial. Okay, so this part we will be, obviously getting, if you were happy to participate, we'll get your consent, and then we will conduct like a screening process. All right, so part of that screening process is to determine that, how you going? Do you think that you need to have a bit of a break?
I'm okay. I think I just kind of zoned out a bit there. Sorry. Okay. Yeah, it's just lots of information.
It is lots of information. You sure? We can have a break for 5 minutes if you like.
No, I think I'm okay. I'll just get a drink of water.
Yeah, take a minute or so.
Yeah.
Okay to move on.
Yeah, sorry.
Are you sure? No, don't you be sorry. That's absolutely fine. I know that this is a lot of information to take on board, and we need to take it in chunks. Okay, so you.
Yeah. No, I think I'm okay. It's just sometimes the medication just makes me a little bit drowsy.
Of course, absolutely. Okay, so that first process is just to determine that you meet criteria. Okay, so we need to know that you actually do indeed have a diagnosis of psychosis. All right, so what we will do is a diagnostic exam, I suppose. So we will be asking you a whole host of questions in relation to your illness, and at the end of that session, we can determine, that you actually do indeed have a diagnosis of psychosis.
I mean, can't you just look at like my scripts or like a letter from my doctor or something?
Yep.
Because I mean,
that's part of it. That's part of it. We will actually be, with your consent, reviewing your medical records, okay, and whether that be paper or electronic, because we've got electronic databases as well, and talking to your treating team, because they're going to be part of that process of referring eligible people to us like you.
Yeah.
So
okay. It's just I guess like doing all the testing again. It's just like I've already got it. So why do you really need to do it again? It doesn't really make sense.
Okay. So for us, that's what we believe, that we have to have, documentation, even though it's documented in your medical records. That's part of the process. But we also have got a diagnostic tool, and it's a research tool that determines, I suppose similarly, the diagnosis, the clinical diagnosis that you've received from your doctor. So it's just a double check.
Okay. I mean, it doesn't really make sense, but I guess. Okay. Yeah.
What?
I just if it's already documented that I suffer from psychosis, why I have to do it again? That's all. It just
sometimes. So if I can be frank, sometimes patients get a diagnosis and it's not necessarily correct. They might be in a preliminary stage, of having a diagnosis. So what we're determining is that for this clinical trial, you do actually meet the criteria, for that diagnosis.
All right, yeah.
Okay, all right. So the medication regime, you will be asked for 12 weeks to take 2 tablets twice a day. So 1 in the morning and 1 at night. Okay, so two capsules, 1 in the morning, 1 at night. All right, and I suppose for most patients, it's easy, or participants I should say, it's easier just to do it at the same time, morning and night, so that you get into a routine, of taking that medication. And you're on medication now, so, as I said, you'll be taking it in addition to that other medication. Okay.
So what happens if I miss a morning or something like that?
Yep.
Can I make it up in the afternoon or 2 at night? Or,
yeah, no. What we want, we'll take records of that, so we'll be contacting you. So say for argument's sake, you miss Tuesday nights. Well, we don't want you to take 2 the next day. That's just a missed medication, and we would record that. And then you just on Wednesday you would just stick to the normal regime of 1 in the morning and 1 at night.
Okay.
Okay.
Right. Okay.
So the dosage is 500 milligrams. So 1 tablet is 500 milligrams. Okay, and then we're asking you to take 2, so it's 1,000 milligrams in total in the day. Okay.
Are they pretty big tablets?
They're like a fish oil tablet. So are you on fish oil at the moment?
No, but I know
do you
how
know
big
what
they are.
how big fish oil are? Yeah, and it's a nice coating, so it's easy. It's easy to swallow. So it's not like a you know, it's like an antibiotic, I suppose, that, you know, the covering, so it's fairly easy to swallow.
Okay,
It's not difficult where it's going to get caught in the back of your
yeah,
throat.
and sometimes, you know, have issues. So
Absolutely.
That's all.
Okay, so they're quite easy to take.
And you can like crush it in half and...
No, we don't want you to do that at all.
Okay.
And it doesn't have that capability of of sort of breaking it in half. Okay. All right. So the next step is how much contact we will have with you. So we will be seeing you on a weekly basis. Okay. So, and that may take the form of seeing you at your scheduled, you know, clinic visits. You know, so after your visit there, or it may mean that, you know, you may not want to come into the clinic on a particular day. You may want us to visit you at home. Okay. So we'll come out to the house, or we'll see you here at the clinics. All right. So, and during that time, those face-to-face visits, we will be conducting a series of clinical assessments. Okay. So psychological assessments. So we're going to see you. So 1 week we're going to do face-to-face, and then the alternating week is going to be a phone call. Okay, so physically face-to-face we'll be seeing you once a fortnight, and in between those face-to-face visits it'll be a phone call. Okay, and during that, so as I said, with the face-to-face visits we'll be doing some clinical assessments. Okay, so psychological assessments, which will take up to an hour. And then again, we'll be, you know, doing it at your level, at your time frame. You know, if you need to have as many breaks as you require, that's fine. We will fit in with what suits you. Okay?
Okay.
And then during the phone call, what we'll be doing is just asking you about how you've been going, how you've been, you know, going with the medication in terms of, you know, have you been taking it every day as prescribed? And then also we'll be just making sure that you're still happy to continue, you know, with the clinical trial. Okay, so that's those visits. All right. So then, how are we going? Do you think you need to have a break?
Yeah, maybe just a bit. You know, it's so much stuff.
Okay.
And
All right.
like, how far have we gone?
Well, we've still probably got about halfway to go. Yeah, we only halfway.
Yeah.
Need to have a 5 minute break.
Yeah, I
need
think
to go down and have a
that might be
cigarette
good.
cup of tea.
Yeah.
All right, no worries.